In this video, I'd like to show you some time-saving enhancements that we've added to Alta 3.3 that'll help you document that patient encounter where you don't have a template. The first thing we'll do is we'll start by going to the options menu, and I'd like to show you a couple things here. The first thing is automatically convert ROS findings to HPI and merge the DXPrompt with the default template. So let's close this window and go to the AP section. In general, I try to do the AP first. We'll see when we get to AP that we've got a split screen now with the patient's diagnoses on the left, and we have the default template list on the right. And for this example, let's say I don't have a template, but off my default template, I'm going to use URI. And I may go to my order sets tab and put in some orders. I'm on the training database, so I don't have the right orders, but I'm going to get a CBC, a throat culture, and a rapid strep, and I may give some Motrin and some Entex. I've got Sudafed here, but pretend it's Entex, and we'll submit those off. And now we'll go to the Procedures tab. We'll go ahead and add the throat culture and the rapid strep in other therapies. I like to add frequent fluids, hand washing, and come back to the clinic if things get worse. And of course, you'll free text the rest of the plan here. So this is where you free text. I hit OK. And now the assessment plan portion is done. I'm not coming back. Go to the SO section. Here the default template loads. And in this case, the scenario is that you don't have a disease-specific template. So the first thing we're going to do is hit the DXPrompt button. Here you'll see that we've included the patient's problem list as well as all the diagnoses from this current encounter. And I've added upper respiratory infection already, so I could reuse that here. So select it by highlighting it, and it's set to merge with my default template, and go ahead and press OK. And I'm going to go to the ROS tab. In the ROS tab, I've placed my Visit 4. In the Visit 4, we're going to go ahead and type the story. The patient's here with flu-like symptoms, not taking any medications, and continue typing the whole story. Now keep in mind, I could have used my favorite AIM form right here and pulled it out. The concept is the same when you do the DXPrompt. Notice that the symptoms in the HPI that came back with the DXPrompt, fever, chills, nasal drainage, are also in the ROS tab. But we've made this system bring back the DXPrompt items merged with the default template, and those items are in blue. So by staying on the ROS tab, you can click plus and minus through all your symptoms, and the system will automatically separate the abnormals from the normals. It'll put the abnormals in the HPI section. So here I'll pick cough, nasal discharge, I'll click headache, and those items are automatically flipped up to the HPI section. And if I say no fever, no sinus pain, no earache, no sore throat, no chest pain, you'll see that the abnormals go up to HPI automatically, and the normals will stay down in ROS. So when you go back to read the note, it's easy to find out what was going on. The free text is in the Visit 4, the abnormals are in HPI, plus any pertinent negatives, and everything in ROS is going to be normal or negative. Now, if there's a pertinent normal negative that you want to put up into the HPI section, select it like no fever, and hit the ROS HPI button flip, and that'll send that abnormal negative up to the HPI section. We'll do it again with wheezing. The patient had no wheezing, and we'll flip that up. Now let's go to the past medical history. Check off any items here. Off the default template, tobacco and alcohol use, as well as items from the DXPrompt here. And in the physical exam, go through and add in what you need to. So they're alert, they're no distress. Nasal mucosa was red. TMs were normal. Tonsils were a little bit enlarged. There was no wheezing. And the heart was normal. And anything that you need a free text, click on this free text button. Go ahead and type it here in this free text block. And we'll go to disposition. Now, if you're the type of person that does the SO section first and then the AP, then let's go back to SO. So here in SO, say you're going through documenting your note, you do the DXPrompt. So we'll go ahead and hit that. This window pops up, and let's say the patient's got a lateral epicondylitis. So let's put that in. Hit Find Now. It's set to merge, and those terms come up in the ROS and HPI. So go to the ROS section, click on the abnormals, they'll automatically flip, and then go to the physical exam and go ahead and put your physical in. Now, let's go to the assessment and plan module now. And what we've included here is all the DXPrompt items in the list. So more than likely, if you do a DXPrompt on lateral epicondylitis, you're going to use that in your note as the diagnosis. So we'll double click on that and it'll add. And of course, if this is a diagnosis that you see a lot and you want that in your default template, you could right click on it, select Add a Default, and it will show up on your list.